Hi, I'm Harry Wingfield from the UCF IRB staff. This module covers how we determine if a study is classified as human subjects research or as not human subjects research, which is also called NHSR. Let's talk about the word human in human subjects research. The definition of human subjects research has two parts: the definition of human subject and the definition of research in the context of human subjects research. This slide covers the research definition of the human part of human subjects research. Humans. It involves human subjects defined as a living individual about whom an investigator, whether a professional or a student, conducting research obtains information or biospecimens through intervention or interaction with the individual and uses, studies, or analyzes the information or biospecimens, or obtains, uses, studies, analyzes, or generates identifiable private information or identifiable specimens. Let's focus on some of these key terms. Living. To fit the research definition, the person must be alive. Dead people are not covered by human subjects research regulations. About whom? Asking a doctor to tell you how many patients she sees on an average day is not collecting information about the doctor. It's collecting information about the doctor's practice. Asking the same person about how she copes with the stress in her job is asking for information about her. Intervention or interaction. For human subjects research, you're obtaining information or biospecimens through intervention or interaction. The Code of Federal Regulations in their DHHS regulations defines intervention as both physical procedures by which information or biospecimens are gathered and manipulations of the subject or the subject's environment that are performed for research purposes. Interactions are not limited to in-person or in face-to-face meetings online. For instance, surveys are an interaction, even if they're done anonymously with no direct contact between the subject and the researcher. Let's talk about identifiable data or biospecimens. Research is also human subjects research if it involves identifiable private information or identifiable biospecimens. That's why doing a chart review or a records review is still considered human subjects research, even though there's no intervention or interaction. That word "or" in the definition is important. Now let's consider the other part of human subjects research. What is research as it relates to what gets classified as human subjects research? It must be a systematic investigation, including research development, testing, and evaluation, which is designed to develop or contribute to generalizable knowledge. It must also be designed to test a hypothesis and use a formal study plan and set of procedures to reach the objective of drawing a conclusion based on that hypothesis. This is your research plan. The application forms and protocols you fill out will ask for this information. The IRB reviewers need these clearly written out so that we can make our determination or approval. Example, testing a new treatment for an infectious disease is considered generalizable because the results could apply to anyone who has the disease and takes the treatment. However, surveying these patients on their experiences with the check-in procedures at that infectious disease clinic may not be generalizable because patients at other clinics that have different check-in facilities, staff, and procedures may not have the same opinions on their check-in process. Evaluation of a course at UCF College of Medicine is likely not generalizable. Even if other institutions have a course by the same name, they may not be taught the same way or cover the same topics. The project may be research in the broader sense, even if it isn't generalizable, but it doesn't meet the regulations definition of human subjects research. And there's more information on this coming up. Now we're going to talk about the types of IRB review. These are roughly based on risk level, but include requirements that the project meet certain criteria for each type of review. The review level that is considered lowest review level is for not human subjects research. We just discussed the definition of NHSR. Now, I'm going to talk about sending these projects to the IRB. For NHSR student projects and for any NHSR project that needs an IRB letter for presentation or publication, you must send an NHSR submission, also known as HRP-250, to the IRB. Only the IRB reviewer can make this determination. This slide recaps the definition of research and the definition of human subjects that were presented earlier. If a project does not meet either definition, it is not human subjects research. Note that getting an NHSR determination does not mean your work is not scholarly or not publishable. Many NHSR projects have been published. The publisher almost always requires the IRB's determination letter. We do not issue determination letters after the project has been completed. The best we can do is issue a statement that if we had reviewed the project prior to its initiation, it likely would have gotten an NHSR determination. Now let's talk about filling out the form. The first set of categories for NHSR determination that you will see on the HRP 250 form deals with existing data or biospecimens. Not identifiable data or specimens means that the research is NHSR, but to meet the criteria for de-identified, no one on the study team can have access to any identifiers or to any code or key that can be used later on for re-identification. If it's not identifiable, it meets the criteria for not human subjects research. Data that is publicly available and intended for public use also does not meet the definition or criteria for human subjects research because it is not private. Remember, the definition of human subjects required the information to be private information. UCF does not allow data taken from social media to be reviewed as not human subjects research. This is because people on social media generally do not expect that their posts or comments will be used for research. Therefore, it meets the UCF IRB definition of private, and this means data from social media would fall under a different category because it is human subjects research. When you fill out your HRP 250 form for NHSR, don't forget to include the brief summary where the submission form asks for it. This gets missed fairly often. Even if the project does not meet either of the two criteria related to de-identified or publicly available, it still may be considered not human subjects research if it falls into one of these categories that usually involve research that is not generalizable. This includes scholarly and journalistic activities like oral history, news publications, biography, and others. Case studies of a single person, group, event, or community, if it is not generalizable beyond that. If your medical case study includes more than 3 cases, it cannot be reviewed as NHSR. Quality assessment, quality improvement, covering a single program or site. For instance, you might want to survey patients at a clinic about their diet, do a diet intervention, and then meet with them again to see if their weight and energy level has improved. This is quality assessment and quality improvement. Program evaluation is for projects that evaluate an ongoing program. Suppose you were doing a survey of workers in UCF exercise facilities to see if a change in working conditions has been effective. That would be a program evaluation. It meets the definition of human subjects, but since it's not generalizable beyond that facility, it does not meet the definition of human subjects research. Other is for projects that do not fit any of the other categories, but either don't involve humans, like a study of fluid dynamics or a study using mice, or they are not generalizable for other reasons. And now we have a question. Which of the following would be considered human subjects research? Choice 1, comparing 2 methods of measuring muscle strength in healthy adults. Choice 2, comparing tendon damage in cadavers. Choice 3, a quality assessment of a plan to reduce injuries in a Little League team. And choice 4, analyzing published data on NFL players. And the correct answer is number 1, comparing 2 methods of measuring muscle strength. Research on cadavers is not correct because the definition of human subjects requires that they be living. A quality assessment plan is usually not generalizable. Published data is not private information. That's the end of Module 3. The next module will cover review levels of research that is human subjects research. These are exempt review, expedited review, and full board review.